Really, this seminar is just to talk about kind of the way that COVID has really affected our ability to practice and help build families. I would say, like everybody else, while COVID has had a dramatic impact in terms of my daily life and the way we do things, the core function of what we do will continue to go forward. It's just that we have to do it in a little bit different way than we did it before. In regards to us taking care of patients, as the pandemic became more widespread, the American Society of Reproductive Medicine, which is really our professional association, came out with a statement that recommended that we temporarily suspend fertility treatments. So what did that actually mean? It meant that the patients who were going through treatment at that time, patients, egg donors who were going through treatment, they were actively going through treatment, that we could finish up the treatment for them. However, for example, for patients that were having, like surrogates, for example, which is the second part of the process, we should put that on hold until things kind of settle down. After that period of time, that we then had to kind of decide how we were going to move forward in terms of reopening our fertility practice. And like I was saying before, that involves doing things a little bit differently than what we did before. So, for example, in the past, we would also, we would see patients in our office. I would sit and talk to intended parents. I would talk to surrogates at a table, and we would kind of go through their history and understand, what was occurring. Well, really, we've been doing a lot of that through the same format that we're talking about right now, and that's through Zoom. So what is the evidence that, that COVID has any effect in terms of fertility? And that is that has an effect on sperm production, has an effect on egg production. And the fact is there's really no studies that really show that there is a negative effect. This is very new because of how rapidly this has evolved. There's new information that's coming out, but certainly so far, when you look at the studies from Wuhan, China, where they had an initial experience and then subsequently in Italy, that there do not appear to be studies that conclusively show a negative effect in terms of on fertility and the ability to get pregnant. Again, in terms of evidence of elevated risk during pregnancy, that there is very limited information in regards to the risk to the fetus and to the woman. The early studies in China have not demonstrated an increased risk or severity during pregnancy itself. And babies that are born to mothers that have COVID-19, it's so-called vertical transmission, has not really been documented. So that's very reassuring. So by and large, most, obviously, that if you had a surrogate, for example, that was going through, and using and doing the social distances and things like that, that it's certainly not a reason why you would say, okay, now I need to wait for 2 years until there's a vaccine developed or anything like that, because there don't appear to be any adverse effects. Right now, that would be significant enough to make it where it would not be safe to proceed with pregnancy. But we do that, quite frankly, in our office right now for even our employees, and that is take their temperature every day, requiring them to wear face masks, and also doing things to reduce the exposure. So one thing we do is we do Zoom consultations with our intended parents, with our surrogates, with our egg donors. So, and then when they come into the office, which we do have to, when they actually come into the office, that they come in for an ultrasound and blood work, but we minimize the interaction that we really need to have, which is really protective for them and protective for us. Initially, both egg donors and gestational carriers, initially they fill out screening information, and they looked at that, and we do that like we did before, but as opposed to having a visit with them face to face, where we spend 45 minutes talking to them and reviewing their history, we do that through Zoom. And then when they actually come in the office, they come into the office and we do an ultrasound, we do blood work, and then if they have consents or things like that, then that can, that could be done at that time, or it could be done by Zoom if need be.
So most agencies have continued on fairly unaffected by the recent coronavirus issues. The average journey takes somewhere in the neighborhood of 15 to 20 months to unfold. And there's a lot of upfront work required when you sign on with an agency, including creating your profile, looking to kind of collate your preferences as it relates to what type of surrogate you want, and then also searching through kind of relevant egg donor databases to search for the right egg donor to start your family. And all of that type of work can be completed fairly remotely and over kind of just like we're doing right now. And so as I said, we're still taking a lot of precautions here. We're not hosting people in our offices. Our offices are actually all closed at the moment, and all the staff is working remotely. And so we're doing everything via telehealth. It's something we're pretty experienced with anyways. At Circle, at least, we have about 75 employees, and about 35 of them already work remote. And so for us, this is kind of just an extension of business as usual, albeit without kind of the in-person office meetings that we occasionally have with parents. And the last part is also pretty important. All of our surrogate screening and our egg donor screening and whatnot, all of that happens remotely up until they travel to the clinic, when a doctor like Dr. Goldstein would take the donor or the surrogate through an in-person physical and in-person screening. But all of that upfront work can be done on our end remotely. So no big change for us at the moment. And so if you're a family that feels like surrogacy is the path for us, we've already made that decision that that's the method in which we're going to start our family, then now is a good time to at least start the interviewing process of interviewing agencies and interviewing clinics and trying to decide who the right partner is for you. And if you come across that right partner and you feel comfortable, then now is actually a pretty decent time to get started. Yeah, so I think this is exactly right. I mean, the first part of that phrase holds true for just about everything in our daily lives these days. As it might not be back to normal soon, but we will find ways to continue to allow parents to seek surrogacy as a great option. For the Jurassic Park fans out there, it's the Jeff Goldblum, life finds a way. And we will find a way to get this done. And so surrogacy will continue, just as I'm sure Dr. Goldstein is confident that other forms of assisted reproductive technology are going to continue as well. So really good question. And there's a big difference between how we're handling things internationally and domestically. So domestically it's kind of business as usual. Internationally, obviously there's a lot of travel bans and travel restrictions in place. The interesting nuance of that travel restriction is that it does allow travel to the U.S. from a foreign country if you have a relation to a dependent who is a U.S. citizen. Now, all children born in the U.S. are U.S. citizens, and so if you're pregnant, or if your surrogate is pregnant rather, with your child, you in some way do have a dependent that is a U.S. citizen or will be a U.S. citizen very shortly. And so geography by geography, we've had success moving the needle with local embassies to allow parents to come to the U.S. For the birth of their child. And we've had good success with that. I think since April 1st, we've probably had about 25 babies born to international parents in the U.S. And I think we only had one that missed the birth of their child. Everybody else we were able to get into town, and sometimes right by the skin of their teeth.
One thing has been that in terms of monitoring patients, that during this process now, it's definitely, every week it's better. So in other words, 4 weeks ago, we had surrogates that were, they were going through monitoring. They were pregnant, for example, and we were having some of those surrogates actually coming to our clinic here, which is really what we like to do. But the thing is that they were not having, we were talking about before about having monitoring done at outside clinics, but there were some outside clinics that were not seeing anybody that was not, there was outside monitoring, so to speak, because it wasn't really their patient, and they were really, and so that created some logistical issues with us, but it never was an issue whereby it changed the ultimate, the ultimate outcome. So no, we haven't really seen it, any effect in terms of patients who are certainly pregnant. And then in terms of new patients that are coming in, we do have in terms of their evaluation is a little bit different, like I was talking to you, as well as doing testing before they're actually cleared to proceed with the, with the process. But that's not any different than, people that are being tested that are not surrogates, that are just, that are trying to make sure that they're not like a carrier of the disease. And so that really has not been, it's a little bit different, but it's, I have not seen really any adverse effect certainly in terms of surrogates, where there have been any issues from the pregnancy perspective, or if they went into labor early, or issues with the baby. We haven't really, we have not really seen any issues with that.
No, we've actually seen it hold up fairly well, over the last couple of weeks. I think, for us as an agency right now, we're running, about kind of 85% of normal on the surrogate side. On the parent side, we're running about 80% of normal. So kind of match times are staying pretty static over the last few weeks. Now, I think, as uncertainty continues to decrease kind of nationwide around coronavirus and the effect of coronavirus, but perhaps the economic recovery does not follow as quickly. My anticipation is we'll actually see an increase in the number of surrogates that flow into the field as people see it as an opportunity to, if they've had successful pregnancies in the past and have a kind of a stable life already, generally speaking, a good opportunity to kind of supplement their income from a household perspective by going through a journey. So right now, kind of similar wait times as always, somewhere in the neighborhood of 3 to 5 months, depending on your preferences and requirements. And I would anticipate that'll hold. Actually, we have seen a bit more decrease on the egg donor side of things. I think a lot of the kind of core demographic of egg donors, you're talking about women, between 21 and 26, that population, I think, is just, it's not kind of a burning need as much to jump into something like this. And we've seen a little bit marked decrease on the egg donor side. Again, I think that is probably as uncertainty kind of decreases nationwide around coronavirus. My anticipation is that will probably quickly rebound. But at the moment, we've seen a little bit more of a decrease. Somewhere probably in the neighborhood of 40% decrease versus 15% on the surrogate side is what I think I said. First off, I think that it's unlikely the coronavirus situation is going to markedly change the cost for a journey in any meaningful way.
So certainly in terms of testing, it may be like when we're talking about the antibody testing, that if you have someone that has positive IgG antibodies, that may actually be a preferred surrogate compared to someone that's not, that someone that's actually been, most of the people that are infected with COVID don't even know that they are infected. And unfortunately, that makes it so frustrating because in the meantime, they're, shedding the virus and allowing other people to be infected. But it turns out that if someone's actually tested positive for COVID from the antibody response, and they have positive, like for example, IgG antibodies and negative IgM antibodies, and they're not, they're not actively, they're not febrile, then that would actually be, and someone that, that for example is that if their nasal swab is negative, which would most likely be the case, that would be a reason to pick that person as a surrogate as opposed to not use them.